welcome Dr. Pecora.
Thank you.
Great to have you with us in our series, The Value of Medical Innovation, where we're interviewing leaders to hear their perspective on innovation and what they're doing in innovation. And frankly, you're our first subject because of all the amazing things that you're doing on innovation. So we want to hear about that today.
Sure.
So I know that you're working in real-world evidence, the application of real-world evidence to really, at the end of the day, why you're doing this, why this whole industry is doing this is for patients. So can you talk a little bit about that, what the work that you're doing and the difference that it'll make?
Sure, thanks. So, like people that do what I do, I've spent my professional lifetime working with industry, academia, and scientists, technologists, and fellow clinicians to change the otherwise natural history of this disease we call cancer, so that young people can have their life back. Middle-aged people can look forward to seeing their grandchildren have children. And the whole idea that we've spent since President Nixon declared war on cancer many, many years ago now, that the fruits of these labors and the billions and billions of dollars we've invested to get here, the whole idea is we're now here and we can't afford it because we're spending too much on healthcare and it's too expensive. It's just an anathema. We can't have this happen. It's crazy. Do you imagine somebody you love, there was a medication that could cure them, but we can't give it because we can't afford it? But that's the road we're on. My simple idea was, why don't we get people who raise money on Wall Street, develop drugs, create new paradigms, why don't we use that as the venue to try to fix the healthcare problem? And that's how I got personally involved in this whole thing on value. And in value, it's very simple. It's the Goldilocks formula. Don't do too much, don't do too little, do what's right every time. And if you do that, the math will show you clinical outcomes will improve for the population, and total cost of care will decrease for the population. So you actually get your cake and eat it too. You get better outcomes, lower total cost. On the individual patient level, sometimes you'll spend less money and get the great outcome, but sometimes you need to spend more money to get the great outcome. But you give the individual the best possible outcome because you're giving them the best possible care. That's what precision medicine is. But for the population, unfortunately today, for most people, we're doing too much, or we're not doing the right thing and wasting money. So that led us to this concept of, instead of paying for processes or services, I did 3 visits, so I get 3 payments, I did 10 visits, I get 10 payments, let's pay for outcomes. And that's what a bundle is. So we're going to pay you for the outcome. If it's breast cancer and the goal is removing the breast cancer and giving chemotherapy, let's pay you for that you actually did that and you got the outcome you're supposed to. So we started down that path, but it became clear to us that you needed a new form of information technology. In this room, that a bunch of us figured out that you can't do this with words. You needed to digitize it. So we did what other industries did. We data compressed using ones and zeros, and we took the entire biologic narrative of cancer and we put it into a digital code called the coded nodal address. And we launched a company and got now our 6th patent for that. Horizon Blue Cross has invested in it. Horizon Blue Cross is using it. We're using it here at Hackensack Meridian Health, and it's now starting to be used across the United States. And in the simplest of terms, what it does is it shows the doctor, all right, for the last 3 years, we've broken down your patients into these digital codes, so you're putting likes with likes, because it's numbers, so you're putting your number 1s in one bucket, your number 2s in the next bucket, and the numbers describe everything that's relevant about you, the disease you have, where you are in the history of your disease, and what the intent of the doctor's therapy is. And we show the doctors, okay, so for this exact type of patient that's now sitting in front of you, the last 3 years, everyone that was just like this person, what did you do? And which of the choices that you made gave you the best outcome, and then secondarily, if possible, the lowest total cost of care? And what we found is the variance in care choice and the variance in cost is huge. It's not little, it's huge. So if you can reduce it even by 20%, you're going to significantly improve outcomes and reduce total cost of care. So we've started to do that. We're in a prospective payment bundle with Horizon Blue Cross for breast, colorectal, and lung cancer. And we're just starting to now look at the data. And it's our greatest hope that this is going to be realized, that we'll be able to use precision medicine, decision support using real-world evidence, big data. We've partnered with Watson so that we can do machine learning and artificial intelligence so that while the doctor's asleep, the machine is iterating to figure out, hey, maybe there's even a better way to do it next time based on the data that's going in to drive outcomes up, drive total costs down, so we never have this conversation about rationing.
Thank you so much for spending time with us today. Thank you for the great work that you're doing, the promise that you're delivering to all of us who are watching your work, who are listening here today, for Hackensack Meridian, for the new medical school, and for patients everywhere. Because as we say at BioNJ, patients just can't wait. So thank you, Dr. Pecora, for spending time with us.
Thank you.